My name is Alex Abreu. I'm originally from Brazil, so I'm proud that as the years have gone through my life, I had the opportunity to come to the United States and be trained, and more important, to be engaged actively in the American Academy of Sleep Medicine projects and the visions from the past and the future. So this has been a blessing for me because very humble coming from what people would call a third world country, coming to America and being taken by this group with open arms has been a satisfaction. So the way that I look is I come from nothing, taken to the sky and going to the moon right now. And my future is going to Mars, following the footsteps of the Academy. And that's where I think the Academy has brought me, and that's where the Academy is going to take me in the near future as well. So my journey to get to sleep medicine, people always, when doing interviews, the fellows always ask us, like, how did you get to this? What brought you to sleep medicine? And I believe that as many of the other peers that I had, sleep medicine, I didn't find sleep medicine. Sleep medicine found me. So when I was doing pulmonary critical care, my great mentor, Dr. Alex Abreu, he actually showed me what we call, I was joking earlier, the dark side of the force, which is sleep medicine, and how important sleep is to your well-being and the impact that you can actually have. So coming from a background of being an aggressive person, very procedure-oriented, sleep medicine never felt that it would be a career path for me until I found Alex in my life, and he showed me how important the quality of sleep is and what the satisfaction that you're gonna have. And how beautiful it was, going to his office and seeing patients from multiple generations coming to seek care, the relationship that we had with the patients on the long term. It was incredible. So seeing all of that, for me, it felt like almost natural to continue in this field and moving forward from that point on. So my initiation in sleep was primarily through mentorship. So one of the things that my mentor, Alex Abreu, was very proud is how important and how empowering the American Academy of Sleep Medicine had been in his life and in the future of sleep medicine and what we could generate. So there's one thing that he asked me during the training: whatever happens, whether you go to private practice, whether you go to academics, I hope that you continue engaging in the American Academy of Sleep Medicine and you don't let the field die, because we need people like you and all the trainees that come out from this to continue their legacy in the long run. So being that, I go now to private practice and I'm still engaged in the academy, and all of a sudden I had the opportunity to come back to the University of Miami to continue and work and train the new scientists for the future, particularly in sleep medicine. And now I'm engaged in the academy. So I volunteer to committees, and as any journey in your life, nothing is easy. So people always say, well, you just volunteer, you get in. It's like, no, I volunteered and I didn't get in. And then I volunteer again, I didn't get in. And I was like, and then I volunteer again. And my motto is always, you put an obstacle today, that doesn't mean it's an obstacle. That means that, are you really persistent? Do you really care? Do you really want this? And after 4 years of application, I get this phenomenal letter saying, hey, by the way, you're welcome to join one of our committees and start your tasks. And what is actually very, very interesting is as you go into the committees and you start engaging on the academy, you start realizing that everybody's the same. I was treated as if I was the president of the academy, even though I was considered as myself as nobody, because I had just started being engaged in committees. And it was very welcoming to see everybody from leadership reaching out to you, trying to give the support and to guide you and teach you to be a better person. And as I continued in the academy, then I had the opportunity to chair, which was one of the most important things that I have, I think, in my career, which is chairing the accreditation committee, which is incredible because you're trying to take care of physicians, patients, technologies. You are actually setting up the rules and saying what quality of care on sleep medicine is. And now you can dig into the accreditation process and say, wow, this is the impact that the Academy has done to make sure that the field evolves right, and patients are properly trained. And the medical professionals are actually respected as sleep physicians, which is something that didn't happen 40, 50 years ago when sleep medicine field started, and people didn't feel that a sleep physician was actually a specialty. It wasn't actually needed. So the Academy brought to all of that. And in my journey over the last decade in the Academy, I have grown significantly as a human being. So let's forget about how much smarter I may become because of this experience. It's just the experience of becoming a better person, a better father, a better husband, a better son, a better teacher, because you learn from others and you see how you should be treated and how important is the great relationship with our peers, regardless of the level. So the Academy just strengthened my foundation, made me a much better man, and I can only see that my growth as a person over the last decade hasn't stopped. It continues evolving. And then I stumbled into the opportunity of being a board member of the Academy Board of Directors, which is also interesting because when I applied, I got a denial letter and say, thank you very much for applying, and that's okay. And I applied again. And this time I was actually lucky because I only applied twice. That was the second time. And on my interview process, I told them, you know, I'm over here, open arms, whether it's going to be today, whether it's going to be in 2 years, whether it's going to be in 5 years, or whether it's going to be never, I'm still going to apply. Because if I believe in the society, I believe that this is something that actually drives what sleep medicine is and quality of care. And I just want to be part of the Academy in any sense, whether it's board of directors or whether it's just on committees as a volunteer, just being engaged is what drives me over here. And this is an incredible place. This is the one event that you can go and you relate to everybody, from the staff that's incredible, from the physicians that come to the group, from leadership throughout, and it's incredible, the sensation, the feeling when you come to this. There's nothing more inclusive. If you really look at the academies, young guy from Brazil, is on the board of directors of the American Academy of Sleep Medicine. You don't want to talk about inclusion. This is as inclusive as it can be. You know, when you look at the group that we actually meet on a regular basis, all different backgrounds, skin color, religious beliefs. So this is the place that I like to come, and that's the place that I like to enjoy meeting people, because I have strong beliefs that everybody that comes tends to have the same mentality that wants to collaborate and grow together. So I began reviewing the HSAT systems with, at that time was Nancy Collop and David Coleman that's on board with me today. It was very interesting because they were already working on this task for a while. And I think they got tired of my emails asking for something that's like, okay, we have this task and can you join the group? It's like, great. So I joined and I met David, I met Dr. Collop. It was very nice, a great interaction. And then from that point on, it became the accreditation committee. I stepped down and then I went to interscoring reliability. So I became one of the gold standards of what the interscoring system is. And I tried to help and learn, because the people that we meet on a regular basis, on a monthly basis to do the interscoring, they were phenomenal. The discussions that we had, they were incredible. Everybody took your point of view and they accepted. So it wasn't my way or your way. They accepted everybody's point of view. We came as a group decision from the ISR, and that was a phenomenal experience. Then I go back to the accreditation committee all over again. Now I'm going back to the accreditation committee no longer as a chair, which before I had already served for like basically 6 years. And now I come back as not a chair. And interestingly enough, like some of the people that I was chair before, they are now into the chair position, co-chair position. And it's so nice when you sit down in a room and you say, well, I know that person. That person who started on this and was learning, was growing. And they look at you, it's like, Alex, you see the model of that we run the meetings? It's exactly your model. I love the way that you did. We're gonna continue. And I'm so proud that I was able to work with you for a year or two, and you gave me such an inspiration and you made me a better person. It's like, wow, I was like, that's when you start realizing that you're no longer just interacting with trainees, but you're getting hardcore, great physicians coming to you that you made an impact on their life. So that alone, it's impressive, and it makes you feel great because you're modifying somebody else's life. The outtake, maybe it will be somebody that was about to step down from the academy, but now realize that there's more. There's people that care, and I fit into this society instead of now feeling excluded for any particular reason. So it's impressive what you can accomplish. And then subsequently, I worked on a very interesting manuscript that we worked for the hypopnea rule task force. And little me is sitting over there with basically 3 past presidents, Dr. Barry, which is a legend on the sleep field, and they're asking me what I thought about it. And I'm like, you asking me about this? It's like, yeah, Alex, you're here. We're asking you, that's your input. I want you to deliver this research part of the manuscript. I want you to write this paragraph. And they sit down and they talk from equal to equal, not top down. And it just like reiterated how important the academy was. And on that project it was even better because some of the meetings that we had were not just us. Some of the meetings we're now coordinating 40 physicians all over the world to talk about these guidelines and how the hypopnea scoring rule affects how we manage sleep medicine, the outcomes, and everybody was equally inclusive. So it was extremely rewarding for me. Now, what makes it very special about the academy from my standpoint of view is how they don't receive just me, but everybody else that I bring in. So when I bring my wife to an event or something, it's like everybody makes every possible move to make my wife feel welcome. They treat my wife as if she was one of them. And it makes sense because we talk about each other all the time and we talk about our families. And all of a sudden you say, wow, these people that are living in Michigan, in Seattle, in Los Angeles, or in Boston, or any other place, or now they care about you, and they're actually an extension of your family. Hey, by the way, if you come to LA, let me know. I want to take you out for dinner. If you come to Boston, I want to show you a nice place. And if your kids are applying for anything in my area, please let me know, and I'll try to help you, or I guide them on the journey. So that alone, now you can come back and you say, when you sit down with your wife, and I have 2 daughters, and you sit down to them and you explain all of this, they understand how blessed I am to have the opportunity to join this group. And even though there's many, many, many hours that I actually don't have to spend with my family directly, they understand the importance and how much that actually feeds my soul. Because this is kind of like part of almost like air. You need that interaction. You need the relationship with this peer group to actually strive and to be better and to look for tomorrow and want something better for the field. So that's where my career has taken and my pathway through the academy on the long run. So currently at the academy, I'm one of the members of the board of directors. And it's interesting because I'm starting my 2nd term actually today. So I was appointed for a 1-year term and then re-elected for a 3-year term. And I always ask them, it's like, did I get the 1 year because you guys didn't like me? It's like, no, maybe we like you too much, then we want you more time over here. And that was the intrinsic joke that we always had. So now, instead of having a 3-year term, I'm gonna have a 4-year term. And it's enlightening to see the growth and how we interact as a group. And it's very interesting to see how we, as a whole, we end up agreeing on what is common grounds for the members. So I never realized as you go to the board of directors meeting that is my way also. It is not just the president's decision. It's not just the elected president's decision. We all have the same weight. Many times we sit down in a meeting and we already have this preconceived idea that I'm going to vote for this and I want such changes. And somebody comes with this enlightening view of what this could be completely different if we went the other route. And after endless hours of conversation and going back and forth, all of a sudden we modify the entire plan because we realize that this is what the members want. This is not what Alex wants. Maybe I want something completely different, but you have to look at a broader spectrum. You need to look at, there's thousands of people relying on the board to make their future better, to make sleep medicine better. There's endless amount of patients that are looking for our guidance so they can become better. Like today we had one of the awards about a patient that had narcolepsy, and you see the impact of that person. Her entire life has changed, and the whole career pathway has changed because of diagnosis of a disease that somebody, which was a sleep physician, engaged this person into the fight to improve and to feel better. And that is the power that we have. We have the power to modify multiple people, the amount of people from different backgrounds, the modification of their lifestyle, and how they're going to proceed moving forward, and their interaction with families, how they behave at home. There's a lot of things that we actually interact in a complete different way. We're like the sleep physician, the family practitioner, the psychologist, the psychiatrist. We are all together. And we also, whether it's good or not, but I think for me it's actually a good thing, we also there when they pass. It's very interesting after you build a relationship for 15, 20 years with somebody, that at the time of the suffering, the time that the loved one passes, the wife or the husband or the family member gives you a call and say, hey, Alex, mom passed away. I wanted you to know, and you invited to the ceremony, and we'll be delighted for you to be there. And at first I always push back. I was like, I don't feel comfortable going. And as things went through, I started going to those funerals and all that. And it brings you peace, it brings you closure. It makes you feel that you actually complete the full circle. You help somebody, you made them feel better when they're alive, and now that they're gone, you have the opportunity to help on the healing of their own family and the people that love them. So that is incredible, and I could have never probably done something like that if I had just focused on critical care medicine, even though they're sicker patients, but the relationship that we have with our patients is completely different from an intensive care unit management moving forward. Currently, there's a lot of discussion on how the field is going to evolve and the difficulties that we're going to encounter on the short and long term. So we just came out from a pandemic, so most sleep labs had to shut their doors for at least 6 weeks. Some of them had to shut their doors for a year and never came back. So now you're dealing with shortage of equipment, devices, and resources for patients to be diagnosed. Now on top of that, because the lab closed, now many of these sleep technologists, the workforce, they actually retired to another field. So they left sleep medicine field and they decided to do electroencephalograms, and they become an echocardiographer or something else, or move to a completely different field. So we lost that. So we're dealing with loss of accredited facilities, we're losing technologies, and now we got the pandemic. A large population of the sleep physicians, they're older. Most of the sleep providers, they tend to be 50 and above or so when you really look. And we're graduating only 150 or so sleep providers every year. So the amount of people that retire is much greater than the amount of people that are finishing their training and engaging in sleep medicine. And during COVID, besides people having to retire because they couldn't be available because of health issues and age, there's a lot of people that also died from COVID, and they're sleep providers. So the void on the field is incredible. And I think that's one of the biggest problems that the academy is encountering is how do we actually continue to grow, make people believe that sleep medicine is extremely important as we believe that it is, And how can we engage them to come to the dark side of the force and actually be happy and enjoy sleep medicine and see this as a path of future? Now, then the advances are also creating problems for us, which is some of the advances are wearables. And how do you diagnose sleep apnea? How do you follow patients with sleep apnea? So those are things that you're perceiving that they're changing, and the academy is always ahead of the game. The academy is already moving forward and trying to look at other signals. How can you diagnose sleep apnea? Which devices are great? Which modalities of treatments patients will benefit the most? So regardless of everything else that's happening, the academy is still visionary in that part. Then because of sleep technology shortage and qualified personnel, then you say, where does AI come into the picture? Because can we actually utilize AI to help us out, to interpret scored sleep studies? So a sleep provider that doesn't have a sleep technology because there's a shortage to score is not at mercy of a company that has high gauge prices. So now the academy engages on that, and the academy is proactive in creating a system that accredits softwares that can actually tell you, this is a good software for you to utilize, and it's safe and it's good. And if you use the software, there's some type of background reliability, which is very important. Then you go to reimbursement. So all the technologies are great. There's a new CT scan, there's a new surgical procedure, there's a new robotic. So the money is always gauged to that. But that only serves a very small percent of the population in the United States. Well, on sleep medicine, or you have sleep apnea, insomnia, hypersomnia, parasomnia, the amount of patients suffering from our conditions that we treat is incredible. And resources are not available to us to get paid, reimbursed. And the academy is engaging extremely well on trying to make payers and CMS understand that sleep medicine is more than important, it's vital. Forget about what people talk that 1/3 of your life you spend sleeping. It's not just about when you sleep, it is how you sleep. What are your behaviors? It's about your pattern. And we influence all of this. And without reimbursement, proper reimbursement to the physicians, people start to decide maybe this is not the right place for me because it's much easier to pay my bills with X than to pay my bills with what I love. My parents always told me, there's something that you love in your life, that's gonna be your hobby, and you're gonna find a job. I was fortunate enough to find my job and my hobby and my love to be the same, which is sleep medicine. But not everybody is as fortunate. So that's the way I look at it. So I look forward. You're looking at a decade or more, you know. I always envision myself as when I'm probably retired, 85, and I look back and I say, 35 years back in my life when I was sitting in these chairs, like, what have I achieved? And why do I say what do I have achieved? Is because I'm probably gonna be a member of the academy by the time I'm 85, and probably after I retire, I'll continue coming to the meetings and enjoying meeting people, as I saw a lot of physicians that had retired events that still come. So I look at the academy as on the forefront on how my vision is gonna go for the next 35 years or so until I retire. And I look at the future of sleep medicine being very interesting because we are adapting to AI. So how can we make AI be something that's reliable and is safe and is gonna add to the practice instead of remove providers from the practice? Because as perfect as AI is, if you have an error of 10% in medicine, is 10% too much? Yes. For me, an error in medicine of 0.1% is too much. My brother's a lawyer. If he makes a mistake, he can appeal tomorrow. If we make a mistake, it may cost our patient's life. So the academy is essential in that. So when you look at the future, I see AI integration to the max, where a provider can now assist their patients in a much better model, where I can interact with my patients remotely via messages that I create They are important for me how to manage my patients so they can feel taken care, they feel included, they feel loved, and they feel that they have been heard, because that's one of the problems that has happened with medicine on my standpoint of view. We became automatic. There's too many patients that we have to see every day because of lack of reimbursement. And then you start feeling that you're losing the touch of your patients. So I'm looking at AI as integrating not just computering and taking us out of the picture, but actually allowing us to become more humane, because we're able to use AI and we can spend our time taking care of our patients as a person, not just as a number. And I think that's one of the parts that I see developing. Then I look forward and say, how are we going to actually proceed and diagnose sleep disorders? You know, not just obstructive sleep apnea, but how can we actually embrace and find out what people are suffering without having them get out of their own home safely, correctly, without mistakes? How can I actually help somebody in a multitude of ways and optimize, get things done faster? Because if I'm able to utilize technological advances to diagnose and to treat, instead of having to wait 2 weeks, 4 weeks, or longer periods to start treatment on my patients, we can go back and start immediately, and we can see how they're feeling and see the impact. So that's something else that I see where the future is going to be. Now, the future is also very uncertain. Uncertain, why? Because we don't know how the wearables are going to go, what is going to bring us in the future, and how well-trained people are going to be on the sleep medicine pathway. It's very uncertain for me, because I don't know if today we have 10,000 sleep providers in the United States, and in 20 years, we're going to have 2,000 sleep providers. I want to have double or 3.35 years, but it's an uncertainty. So that's my fear, because that's my legacy. And I want to look back and say, wow, my field is stronger than what it was when I actually started. As my mentor always says, Alex, when I started, I was one of the few. Now you are one of the many, but I don't want to be one of the few again. So that uncertainty, how we're going to create the next generation of sleep clinicians and sleep researchers, is very important. And the other thing that is very important for me is that sleep is no longer just sleep. People now think about sleep, but also circadian clock. So now you're bringing the whole spectrum of what sleep medicine is, and you stop ignoring what some would say that we have ignored for many years, which is circadian rhythms and so forth. So the battle that we won about the start school time at a proper time, so kids can actually have a good night of rest, be able to go to school refreshed, be able to drive early morning when they go to school without having a higher risk of accidents, is important. Standardizing time, not switching to daylight savings and so forth, it's something that on a circadian standpoint of view is very important. So people need to understand that the future is bright, but we have to follow these pathways. We have to respect nature. You know, nature, God, I'm a Catholic person, so I believe in God deeply. So God made things for a reason. And it's not our job to alter those things when physiologically were made for us. And they're made for us because it was good, it's healthy, it makes us feel better, it makes us feel happier. Now, what I also envision from the academy is where we're going with diversity. And I look at diversity not just sexual, race, language, is everything that we have, trying to be inclusive as we are, trying to respect each other. It's almost like we all respect each other during the COVID pandemic because we're all concerned that we're going to die and we're secluded. And once the pandemic ended, it feels like we went back 20 years. Lack of respect, people yelling on the streets, road rage, shootings, massacres, terrorist attacks. Like, for what? Haven't we learned anything from the pandemic, the period that we all almost died? So And whether you believe it or not, I truly believe that the Academy is going to be engaged on those things to make us feel better, to make us feel more secure, to have a better pathway. Most people don't realize that how important sleep is for your psychiatric condition. The amount of kids that are committing suicide is incredible, it's unprecedented. And good sleep, good health, good quality of life is essential for those things. And the Academy is going to be involved on all that. Why? Because the Academy cares. They care about the people from today, from tomorrow, and the people from yesterday. We care about the humans that live in this place, and I truly believe that regardless of your background, financial status, the Academy is there for us. And on the long run, when you look back, when I'm 85, 35 years back, I'm going to see that many of these dreams that I have fortunately got implemented. Some of them actually have been modified and improved. Some of my ideas are going to be heard, and people will take over ownership, and they want to develop and make it better. So looking forward, I see the American College of Sleep Medicine being not just on the forefront of sleep medicine, but overall medicine, well-being, safeguarding our elders, adults, and kids so we can all age well, have a happy life, and safe. That's the ultimate goal that I see for the Academy. So over the years is very interesting because you look at how the American College of Sleep Medicine evolves on a regular basis. And I'm fortunate to be a member basically for close to 20 years or so. And it's very interesting how during these 2 decades that I have been present as an attendee, where I'm just showing up to the meetings and being actually part of the team engaged on the activities from the Academy for the last decade, you see how the goals have evolved, how we are able to provide more resources for research, for development, how the Academy has modified how they approach Congress, how they approach CMS. We have grown immensely how to protect our providers and our patients from the outside world. We try to create a safe pathway where patients and doctors can actually walk, feel comfortable, and they feel that there's an endpoint. Now, when you talk about growth for the Academy, it's extremely interesting because I'm starting my 2nd term today, my 2nd year. And on this particular year, we just did a 360. People don't stop to wait for the day that they need to make changes. The strategic plan came this year, not because it was needed, it's because the board realizes that the needs from the members have changed, have shifted. And you can't do that when you start making strategic plans every decade, every 2 decades. No, the board is actively working and making strategic moves every 3 to 5 years to make sure the members are heard, that we evolved as a group, that people understand what we're doing, and we're not left behind. You know, technology is there, and things don't go slow anymore. Nothing changes from one year to the other. Things change from the hour to the hour. I'm over here at the sleep meeting, and I'm finding out that Mbappe already signed with Real Madrid, and there's 25 interviews and everything else. So things have evolved. In the past, I had to wait to maybe get to my television to get that. The other day, I'm watching a Messi game on my phone while I'm waiting on the tarmac to fly. I was like, when would I envision those things? So things are evolving so fast, and the Academy has actually moved to that direction, that members have different needs, and members need to be heard. And in order to be heard, we need to sit down and change our strategic plan based on what our members want. The other thing that's very important, how the academy has grown over the years, is that if you really look at leadership, it is incredible the mix of older leaders being part of the academy, but is an overwhelming number of young people like myself being part and engaged in the academy. So the leadership for the last 20 years that could stay quiet and just stay on a leadership position, they came back and they said, this is for you new guys. I want you all to grow while I can still teach you. So the guidance that I get from people that have been in this association for more than 3 decades or 4 decades is unprecedented. So it makes me be better, allows me to move forward and not make mistakes that they made, because they're here to guide me. They want me to be better. They want me to be better than they were. And they're not ashamed of that. They're actually proud when they say, Alex, you're doing a better job than I am. It's like, and they're talking not with envy, they're talking with pride. They're happy that you become the man that you are, and they are part of that growth. That's what I see in the academy, evolving, changing, and accepting everything. So the first one is Alejandro Chadiek. So there's no, I wouldn't be over here on the Sleep Society if he wasn't for him. That's influential. But then over the last few years, I got somebody that from a complete different background besides sleep, as a neurologist, guiding me and helping me, Dr. Raman Malhotra. Took me open arms, guided me through difficult times on the committees, and incredible person from a complete different background, so far away from me, completely different areas from the United States. And I had Dr. Rowley, which just passed the baton today, and it's no longer the present for a few hours. And he was imperative on part of my growth from the academy as well, because I had the opportunity to work with him very closely on the accreditation committees, and the input and the guidance and the trust that he gave me were incredible. Then I started on the board, and I met Jennifer Martin. Incredible. I have no words to express the modifications that Jen has done in my life, what she actually shaped all my behaviors and the way that I interact and the way that I approach meetings and how I interact with others on a heated discussion. And it was incredible the way that she taught me. And it's interesting because it has been 1 year, never met Dr. Jennifer Martin before that in person, and she has been influential in my life. Not counting, the other people that I met on the journey. Dr. Kushida has been a great person to talk and to interact. I had Larry Epstein that I met years ago that, embraced me on the time that I was even going to my promotion from assistant professor to associate professor at the University of Miami. Dr. Pat Strollo, so that just sits down with me and talks like I'm one of his trainees, and nice and fun, and takes you open arms. So I get, Dr. Ramadan is extremely influential, sitting down with him. Dr. Doug Kirsch, I remember being on this meeting when he was leaving presidency and talking about the new accreditation model that's starting now. But we're discussing that basically almost 8 years ago. It was incredible. And the influence that these people had on my life, my career, my personality is overwhelming. So if anybody has the opportunity to experience 1/10 what I had the opportunity up to this time of my life with these people, they will be extremely fortunate. And I can guarantee you, when they look back, they will be a much better human being and much happier than they ever been, just because they're part of this group. It's a group of people that care for each other, care for their patients, they're loving, caring, and they're visionaries. Always looking for what is best for everyone, not what is best for me. And that's why I'm here, and that's why I'm going to stay here. And that's why the day I die, I'll probably still be a member of the ASM at that time. So my family can actually say, by the way, Dad died, and his membership is 65 years, is still active up to today. And we're going to request a lifetime membership post-death. Ultimate goal. Is it going to happen? I hope my kids love me enough that they will actually follow through my desires. But that's something that is very important for me, because this is not an association. This is a family. That's the way I see it. To me, the ASM is inclusive, a family, visionary. It's me. That's what the ASM is. It's exactly what I was born for, and it's exactly everything that my parents taught me, the roots that I was created. That's the ASM.